λίγο. Εντάξει.
Καλησπέρα σε όλους. Σήμερα είμαστε με το David Bomzon, INSA, Yamamoto New Scalp Acupuncture. Buonasera anche a tutti i partecipanti a questo webinar dall'Italia. Ciao amici e mi auguro a presto. Συνεργαστούμε με τον David εδώ και 4 χρόνια με σεμινάρια στην Αθήνα και στην Θεσσαλονίκη. David, is your turn.
Okay, so thank you, Gracia. This presentation will be in English. Thank you to ITMA. I think we have already a 3 to 4 year relationship with ITMA, and me and my partner Avi, he's not with us today. So thank you for having me, for teaching. I always enjoy working with you. So this is actually, if you've been attending our seminars in ITMA or in Athens or in Rome or in Saloniki, so in those seminars we are always teaching the YNSA method and how to work with the YNS method. And we're speaking about the points and the location and doing the practice. So, but often because in the seminars we found ourselves that we have to teach to the point location and practice, and the practice takes up a lot of time. There's not too much time for theory. So, actually, what we have here now, we have an opportunity to speak about the theory a bit more, or in general scalp acupuncture, but we also have an opportunity to speak about the theory of combining scalp acupuncture with, you can call it TCM, traditional Chinese medicine, or you can call it body acupuncture or any other body acupuncture method together to get a better result with a patient suffering from a neurological disorder. So this is what this presentation will mainly speak about. We'll speak about a bit of scalp acupuncture, speak a bit more to the depth how I think scalp acupuncture works, and then we'll have 2 to 3 cases, which I'll demonstrate how we combine scalp acupuncture with body acupuncture to get a better outcome with the result of the patient. So we're gonna do that as well. And when I speak about the cases, I'll also give you. It's not gonna. We'll draw out some of the points, show you the location of some of the points, so you can even try and use them in your clinic. So I'm just going to go to my share my screen quickly. Share. Share. Now I'm going to open my presentation. Full screen. So as I said, this is a seminar. We're going to see the use of scalp acupuncture. It's not necessarily in my practice. I mainly use YNSA, but in these cases, I also used Zhu scalp acupuncture method and combined it with YNSA, and we had a very good result. So we're going to speak about using scalp acupuncture and TCM. But like I said, TCM could be any type of body acupuncture. Meridian theory. I feel that meridian theory goes better with scalp acupuncture, and for treating neurological disorders. Here's my contact information, mine and ITMA's contact information if you wish to contact us to get more information about our seminars or more information about how you can use the method, or if you have any questions, you can feel free to contact us. Contact Avi and I. You have my phone number here. You can do WhatsApp. You have my business email. You also have ITMA's email, and you also have ITMA's website and my website, so you can feel free to use them both. Okay, so before before coming into speaking about how to treat these patients, we need to just go a bit back into the history of scalp acupuncture. And what we can see here in this presentation, or in this slide, we actually can see that there's many types of maps or diagrams of somatotopes that are located on the scalp. So basically, if you would combine them all together, it seems like that no matter where you put a needle, you're going to have some effect on the patient. These scalp acupuncture, we have to divide scalp acupuncture into two, I believe. We have what is called modern scalp acupuncture, which is the scalp acupuncture that Jiao's method, or all these maps here are actually the modern scalp acupuncture method, where if we go back into the history, if we only look here, we have only the scalp acupuncture maps, but we also have acupuncture points that are located on the scalp. And if we go back into history a bit, let's go to the Yellow Emperor, to the Huangdi Neijing. There was mentioned in some of the texts that some of the points that are located on the scalp or on the head were often used to treat neurological disorders, or their terminology of neurological disorders in those days. So we have already then the connection between already there they were speaking about using points that are located on the scalp to treat neurological disorders, and these points were located on the channels. So that was the method that was used, but in those days, and even today, even without learning scalp acupuncture, a lot of the modern scalp acupuncture, a lot of the indications of acupuncture, especially acupuncture or points that are located on the scalp, you see a lot of the indications are used for neurological disorders. For example, if we take, let's say just take gallbladder 19 point. Gallbladder 19 point is a very, very useful point for using patients with balance disorders or vertigo or dizziness, okay, or sometimes even ear disorders. Now, if we go to the anatomy where gallbladder 19 is located, you'll see that gallbladder 19 is located in the area of the cerebellum. So we know that the cerebellum has to do with proprioception, has to do with balance, has to do with could be treated for vertigo. So you have this connection already there in the acupuncture points. Another point, just to strengthen my theory of UB9, bladder 9. Bladder 9 or urinary bladder 9 is also used for vision disorders or problems with the eyes, with the vision. And if you go to the anatomy where this point is located, you can actually see that this point is located in the visionary cortex, in the occipital area, where the vision center is. So this is why this point has an effect on the vision as well. And if you combine gallbladder, for example, gallbladder 19 with bladder 9, bladder 9 point, you actually can get a very good result in treating a patient with problems with vertigo, now, or motion sickness, for example. Now, if you think about it, that your eyes usually coordinate with what your ears or your balance sees. It's very important, your eyes, to know where you're located in space if you're not closing your eyes. So that's one of the things that are important, especially when you're in motion, and we're always in motion today. If we're not walking, we're in a car, and we motion, and our eyes are used also to help us balance us out, so we don't get this dizziness and this nausea. So if you combine bladder 9 with gallbladder 19, you can really have the good effect in motion sickness. So that is or we go for another example we can speak about do 20, for example. If we go to do 20, you can see that do 20 is located right at the vertex of the head. Now, if we take the homunculus, okay, one indications sometimes for do 20 is numbness or paralysis or pins and needles and all these feelings in the area of the foot. But if we take do 20 now, for example, of its location, and we take the homunculus and we combine the two, you can see that do 20 is actually located approximately where the area of the foot is. So I think what you're starting to see now when I'm pointing out these points, that there was a very, very strong connection between the use or the indication of the acupuncture points on the scalp to the neuroanatomy of the brain. And this was the theory in which the first researchers that started developing the modern scalp acupuncture were going with this theory, understanding these points have an effect. These points, if you look at the point, you see where the point is located. The point is located to the neuroanatomy of the brain. It matches each other. So the point's function comes out from where it is located. You can see the same idea if we take even the acupuncture points throughout our trunk, for example. Okay, let's say the kidney points. Okay, the kidney points around the chest. You can already understand there that the kidney points around the chest have some influence or some effect on the area of the heart, of the lungs, or of the upper area of the chest. And it's only because of the indications of where they're located. So if you take the Huato-Giagi points, for example, they're located around the GV, or beside the GV line, or the spinal cord. Okay, and every area there has an influence at the height of a specific organs, for example. Let's say if I go to Huato-Giagi around T5, I'm going to have some influence around the heart area. Okay, so the points, the location of the points, sometimes the indications of the points are according to where they're located, which area they stimulate in some manner. So modern scalp acupuncture was actually developed in the 1950s. Okay, and if you take what they knew about the brain in the 1950s to what they know about the brain today is massive information. Even though they know more about the function of the brain and the location of the points. Sometimes I don't know exactly how everything functions, but they know the anatomy of the brain. They've actually managed to nearly map out all the areas of the brain and the anatomy of the brain. Not necessarily how they function, but the map of the anatomy. So modern scalp acupuncture was actually developed by Chinese physicians, neurologists, who actually were taking Western medicine theory of neurology and combining it into scalp acupuncture, and combining the theory of or the location of the points and the points that were needled, we're combining with the theory of, or not the theory, of the knowledge of how the location of the areas of the brain. So the founder of the modern scalp acupuncture was what you can see here, Jiao Shunfa. He's the founder of the modern scalp acupuncture, and his method is very, very much got to do with neuroanatomy. And what I'm trying to say that actually, if you have lines here, you have the motor line and the sensory line, they actually sit exactly or match the areas of the brain of the motor line or the sensory line, or the motor functions and the sensory functions of the body. The area here, what you see here, for example, is the area of speech. And if you would peel away the scalp and go to the brain, this is the area approximately, these are the areas of speech in the brain. Of course, they're on the left, on the high percentage, between 70 to 80% of the people, it's on the left hemisphere, and between 30 to 20% of the patients on the right hemisphere. But it's mainly these areas on the left hemisphere of the brain. So already here, and like the demonstration which I spoke about, gallbladder and gallbladder 19 or urinary bladder 9 is actually also areas which Jiao started using for vision disorders, for balance disorders, but the method of needling was actually a threading method. But what was very in the first years in what I call in the first years of developing this modern scalp acupuncture, as more understanding of neurology or Western neurology came up, then more understanding how to use these points in a better manner came up. So they actually grow together. The scalp acupuncture developed at the same time as Western knowledge of neurology, of the central nervous system together, or the areas that they're located. So they actually developed together in a good manner. So this is why Jiao Shun Fa's method is very well known even in the Western science, okay, or more accepted than today, or even years back, than body acupuncture, for example, because here actually you could explain what you're trying to do and explain it more in Western terminology. And the Chinese scalp acupuncture of Jiao style is based on Western terminology. So it's very, very easy to communicate between a Chinese medicine practitioner who does Jiao Shun Fa's method with a medical physician or neurologist, because they can speak nearly the same language in some manner and they can understand the idea behind it. But with Jiao Shun Fa, there were other contributors to development of scalp acupuncture. So, and some of them are based on of microsystems and not necessarily areas that correspond with the areas of the brain. Okay, for example, you have Professor Fang Yunping. Okay, you have his map here, some kind of microsystem. This microsystem compared to Jiao Shun Fa, you can see the difference is more of a microsystem and not necessarily the areas correspond to the areas of the brain that match. Okay, the same what you see here of Professor Tang Song Yang, the same. You have two maps, one on the anterior part of the body and one on the posterior part of the body. So you have a hand here on the posterior and a hand here on the anterior, but there's no anatomy connection between the two. But what was very, very important, and then we have Professor Zhu. And Professor Zhu, in his map, he also has the understanding of Chinese medicine. Okay, we'll speak about it in one of our cases. So you have to do a correct diagnosis according to Chinese medicine. But also you have the mapping out according to Jiao Shun Fa, the same mapping out of the neural areas, the neuroanatomy of the brain. So you have actually a combination between modern scalp acupuncture, modern neurology, and even a microsystem in the scalp. That's Zhu's method. For example, if I have paralysis, for example, of my upper extremities, okay, of my left hand. So, and I'm actually the one way to do it, okay, and if I do Western. For the brain to function in a better manner, I need to pump blood, right? I need to pump blood. If I pump blood, blood goes towards the brain in a better manner in the area of the scalp, then I have more oxidation in the areas that have been damaged. If there's more oxidation in the areas that have been damaged, then the areas can recover, okay? So when Professor Zhu speaks about it, okay, if I have to get more flow of blood, okay, so let's needle the area that corresponds with the area of the hand, for example, like Jiao's map. So you needle in that area that corresponds to the area of the hand, okay? But now you have to get more blood flow. So if we have to get more blood flow, what part of the body, does the upper jiao or the middle jiao or the lower jiao pump blood better? So we know the upper jiao is more where you have the heart function and you have the lungs function, you have the oxygen and the blood moving more better. So if we stimulate the area of the upper jiao, we're going to have better blood flow. And if we have better blood flow towards the brain, we're going to have better oxidation. We're going to have better recovery for the areas that have been damaged in the brain. So that's the combination between Zhu's, just a demonstration of Zhu's method of combining Chinese medicine theories with modern scalp acupuncture of neuroscience. But what is very, very important, which is actually was ahead of the time of all these practitioners that developed the scalp acupuncture, that all of them believed that an area that's been damaged can recover. Or if an area has been damaged, you can teach a different area to take that function or overlap the area of damage. So that if you keep stimulating the area, some area is going to take over, and you'll cause more synaptic connections, and by causing more synaptic connections or new synaptic connections, you're going to overlap the areas being damaged, and the function will come back to the body or to the nerve system. But if you think about 1950s, 1970s, when first modern scalp acupuncture was first published, this was very ahead of the time. This theory was like, this theory doesn't exist. No, this can't be true. Because what was believed up to about 25 to 30 years ago about the human brain, there was that in the human brain in childhood develops, but once after childhood, your brain stops developing, okay? And once your brain stops developing, each area has a function. And if that function is damaged, caused to any head trauma, that area is being damaged, the body or the brain cannot get that function back. That was what was believed. But what was they started to understand it today, even up to 25 years ago, that the brain does have the capacity of changing, which is called neuroplasticity. And if an area is damaged, it's not that the brain is going to develop new neurons, but it's going to connect or create more synaptic connections. And by causing more new synaptic connections, I'm going to get the brain functioning better. And I'm going to get, if I have an area that's been damaged, I might manage to overlap that area that's been damaged with new synaptic connections. And with new synaptic connections, get a different area to function or take the function of the main area that's damaged. That is in general what is always happening in the brain. You have a big function, but that big function is broken down to small different parts that have some part of that function. For example, for me to my hand, I have the homunculus, the motor area of the hand movement. But maybe there's other neurons that have some idea or assist in the movement of my hand. Okay, speech is a good example. You have speech areas. You have a number of areas that deal with speech. Some of them are the main areas like Broca and Wernicke, but you have other assisting areas. But what is believed with the correct training, that the areas that have maybe a minor function in that area, so we're speaking about speech, will maybe take a major, will become a more major function, and the speech will return to itself. So it means that if you train again and again, train a function again and again, you're going to recover in the function. And that's how the nerve system basically works. The nerve system, the central nerve system, first gets a stimulation, gets sensory stimulation, then the information goes up to the brain. The brain interprets the information and responds to this information in a motor function. So if you have more stimulation, you might get that area coming back again and again and again. So what was important, what I mentioned before, was I spoke before about blood supply. Okay, so, and now we're going to come a bit deeper into the function of scalp acupuncture. Now, in scalp acupuncture, one of the things that is very, very necessary to do after the needle's been inserted, I'm not speaking about INSA, but after YNSA, I'm speaking about the modern scalp acupuncture. One of the things that was very, very important after the needle was inserted to the certain zones, that was to stimulate the needle, okay? It could be a twirling stimulation, it could be a pumping stimulation of the needle, a picking stimulation. All these types of stimulation was necessary to get the function going better. And the more and more you stimulated it, the more the function went and improved. At the same time, what you were trying to do was, if a patient, after you needled, let's say we're speaking about pain, for example. It pains, well, after you've needled the point, and now the pain has subsided a bit, okay? Let's say shoulder pain. And then you start stimulating the area which corresponds to the area of the shoulder. You stimulate, you start stimulating. Slowly, the pain in the shoulder starts disappearing even more and more and more. So it was very important, that stimulation. Or if you're speaking about neurological paralysis of the arm, well, there's a very slight movement, and then you insert the needle. And then at the same time, once you insert in the needle, okay, now there's a bit of a function in the arm, okay? So you start stimulating. So you stimulate, and slowly you start seeing, through trial and error, of course, you start seeing that the function of the hand improves. And even the patient starts saying, oh, I feel that my arm is a lot lighter. Okay, I have more function in the movement of my hand. So that was very important, that's stimulation. One thing I want to speak about in scalp acupuncture, what I believe, it always has to be supported with manual therapy, or qigong, tai chi, yoga, or douyin. Okay, when you apply a needle in, it's like I heard Zhu once say that when you needle with scalp acupuncture, it's like opening the lock, the door. Okay, but you have to walk through the door to enter the room, and walking through the door is actually doing the douyin. Douyin is the ancient Chinese practice of movement. So you got to, after you've stimulated it, the needles, you got to get the patient to function. So it's also, two things are happening when you ask the patient to start moving. For example, if it's easier for me to move a hand and ask him to start doing douyin and doing all these movements of the hand, the brain starts remembering that this area can move. And at the same time, the brain starts making new synaptic connections, okay? First, it happens in a chemical level, okay? The chemical level is a learning level. So the brain starts causing new synaptic connections. And as I move it more and more and more, with time, I'm not speaking with time in an hour, with time, the chemical connections will be stronger. So with the same session, it will go and improve, but maybe the next day it'll be less. But with time, I'm speaking of a period of time of a week or a couple of weeks, even the function will start returning, because what is happening in the brain, actually, you are actually making, you strengthening the connections, or the new connections that have been made are strengthening. And then already the function is becoming more, it's more of a structural change of the brain, or protein structural change. And if you have a protein and structural change of the brain, you're going to have more, the synaptic connections are going to be more enforced to each other, so you have them functioning a lot better. But so that was the idea in scalp acupuncture. Now that what is important, what I'm speaking about, is that stimulation. What is important? Because that stimulation is actually what I believe is the key word why scalp acupuncture works. Because if you think about it, how can it be that I needle an area of the scalp, and after 2 to 3 minutes, even of stimulating, suddenly the patient can move his arm in a better manner? Okay? There's no nerves there. I'm not stimulating any nerve, so the cranial nerves or anything like that. But there's no nerve that connects to where the hand is. And that stimulation is important. And when I come to speak about fascia, which is one level of how scalp acupuncture works, okay? The fascia tissue, which is located on the scalp. But before that, let's speak about blood flow, okay? Blood flow, we know the blood flow is a closed system in the body, okay? If you get blood that goes up, goes out of the heart, circulates the body, goes through the capillaries, and then comes back to the heart. And you have this oxidation. Blood, according to Chinese medicine, is a loop channel, okay? It's a connecting channel, okay? The blood is if you think about it in a simpler manner, it's kind of a connective tissue, okay? It connects oxygen to oxygen towards to the cells that need oxygen, to the nerves that need cells. It's also nerve system. It connects also hormones to certain areas that hormones need to go. it's a vessel for taking out carbon dioxide. So it's also a vessel that is important in a connection. It's also a channel in a level of Chinese medicine. So you have to also acknowledge the blood and the blood vessels. So if we take going towards the scalp acupuncture understanding, if we look at the how blood flows, so we go and we start breaking it down, we start thinking about how can this movement on the stimulating the area on the scalp stimulate the movement of the blood in the brain. Okay, so let's look at that, because actually when you stimulating, okay, the needle, you're actually causing something, there's even the tiny vessels to pump. Okay, and because the blood system is a closed system, when you get the blood pumping a bit more, moving more, you're going to get more blood flow or more new blood or more oxygen, new oxygen to certain parts of the body, and one of the areas is going to be the brain. So it goes from the heart, goes from the aortic arch, okay, then it goes up to the common carotid, and then from the common carotid, it actually, there's an internal line, which I'm not speaking about here, but there's another internal arteries that go into the internal part of the brain. But from that common carotid, it goes to the external carotid. And then from the external carotid, it stimulates the superficial temporal artery, the occipital artery, the facial artery, the maxillary artery, lingual artery, the superior thyroid artery. So already, and if you take the areas of where the scalp acupuncture points are located, even Yamamoto scalp acupuncture area, and you have that stimulating sensation, you actually in some manner stimulating any one of these, you're causing the vessel to contract, okay, the blood vessel to contract, any one of these blood vessels. At the same time, you're causing more blood flow throughout the body, and one of the areas throughout the body is towards the brain. So that's another connection how between scalp acupuncture and the brain, and why scalp acupuncture works. The next connection, which I found, which is very, very important, is the fascia tissue. Okay, the fascia tissue. Okay, whoever's not familiar with fascia theory, basically our whole body, it's a connective tissue which covers our whole body. Okay, it covers our internal organs. It's like an orange. Okay, if we take an orange here, for example, we have an orange. It's the skin. The white is the fascia. Okay, that's connective tissue. So connected to the skin. Through the skin, it goes inwards towards the area of the bone, for example. But the same connective tissue also covers the little part, the fruit parts. Okay, that's the white, and you have the little juice areas, like little bottles. I don't remember the word. Follicles. Okay, the fruit follicles, also covered by this connective tissue. Okay, so that's, you got to understand that your whole body is covered with connective tissue, and all the organs are covered with this connective tissue. If I would strip away my organs, my bones, my blood vessels, my nerves, I'll have this big plastic bag, which all these holes are, where all these organs used to sit. Okay, so that's the fascia. And the fascia is very, it's got a very, very strong connector to the optomotor system, to the proprioception of the body. It's also got a very strong connection towards the sensory nerve system. Remember when I spoke about to stimulate the brain, you need first stimulation, sensory stimulation. Sensory stimulation goes towards, through the peripheral nerve system, goes up to the central nerve system. The central nerve system analyzes information, perceives this information, and responds to this information. And then through the sensory nerves, through the central nerve system, goes to the peripheral nerve system, and we have a motor function. Now you have to understand that a motor function is not only a motor movement. A motor function could also be secretion of spit, of saliva, is also a motor function. Okay, for example, someone walks into the door with I love chocolate, okay, with the smell of chocolate. It's unbelievable smell of chocolate. And my sensory nerve system picks this information up. it goes towards my brain, and I start having saliva. Okay, my intestines start working. Okay, that's connection. What the brain is doing, that's a motor function responded from the central nerve system. Okay, saliva, or even a hormonal response, stimulate is also a motor function. Okay, but what I'm going back to here to when we're speaking about the fascia tissue covers all these parts of the body, and 90%. Okay, now one of the receptors that sit on the fascia is what is called the mechanoreceptor. About 90% of the sensory nerve system sits on the fascia, and a high percentage of those nerve receptors that sit on the fascia are mechanoreceptors. Mechanoreceptors respond to stretch or pressure. Okay, what do I mean? If I close them more, okay, if it closes, it's going to send a signal to the brain. If it's released, there's not going to be a signal going to the brain. Okay, that is also the connection that when you insert in a needle and you start in that stimulation, you're causing the fascia to stretch in some manner. Okay, when you cause the fascia to stretch, you're causing those mechanoreceptors to send the signal to the brain. And by causing those mechanoreceptors to cause a signal to the brain, you're causing a response. Now, that's one connection of the fascia between the mechanoreceptors. Another understanding, or pressure, okay? Pressure, blood pressure is also a type of mechanoreceptor in some manner, or sound waves is also pressure. It's all kind of a mechanoreceptors of these that pick that sound up. Now, for example, now another thing is that we're going back to when we're going to speak about the fascia tissue that covers all parts of the body. One of the things it does also covers is the blood cells. Okay, the blood cells, or not the blood cells, the blood vessels. So remember, if I'm stimulating, okay, so at the same time I'm getting fascia to stretch and release, stretch and release, stretch and release, stretch and release. I'm stimulating the nerves around on that fascia. At the same time, I'm stimulating the nerves on the fascia, but I'm also stimulating or causing blood to flow in a better manner. So I'm getting more blood flow towards the brain. So I'm getting more, the blood is starting to connect to more and more parts of the body, and also one of the areas of the brain. Okay. And like I said, in Chinese theory, that's the Lu channel. One of the Lu channel is the blood vessels. Okay. So this is a connection between the blood vessel and the nerve system and the fascia. And this is important in scalp acupuncture. Okay, just to strengthen my theory a bit, especially to strengthen my theory about fascia, if we come to the science of acupuncture, okay? This is actually a researcher by the name of Dr. Helen M. Leving. She's a researcher of the connective tissue, which is researching the connective tissue. And she tried to understand what is the connection between the connective tissue and acupuncture, or between the connective tissue and stretching. And she spoke about the connection between what happens when you insert a needle. When you insert a needle and you start twirling it, or to the left or to the right, the connective tissue, as you can see here in the drawing, wraps around the needle, and once it wraps around the needle, causes it to stretch, and causing that to stretch is going to cause the immune system to respond. That's one thing, that the immune system will respond to it, but also the mechanoreceptors, or the receptors that sit on the fascia, will respond to that. So this is how one layer or one level how acupuncture works, and why acupuncture works in one manner. But that's more of the tender muscular meridians. Okay, but like I said, the blood vessel is important, the nerve system is important, also the the lymphatic system is also connected, and all that. Okay, so now when we understand more about scalp acupuncture, I'm going to speak about a bit of a case report. So coming down to, and this is actually how I combine with the theory of Chinese acupuncture with scalp acupuncture. With the theory is that when you work with the scalp acupuncture, you stimulate in the central nerve system. That's the understanding. And you stimulate in the central nerve system through the nerves. okay, through the fascia, but at the same time through the flow of blood towards the area, through that stimulation. So this is, her name is Sarah. It's not a real name. She's an 80-year-old woman who was diagnosed with Parkinson's about 2 years ago. She's actually in a very good condition. She has a slight tremor in her hand. Okay. She has lower back pain, but the lower back pain is got to do with the rigidity of her lower area. She has weakness of her lower extremity. She has difficulty in raising her hands. She feels fatigued and tired. She's unstable on her feet. All this is because she has because of the Parkinson. She's very much leaning forward. So if you leaning forward, you're not too stable anyway because you're leaning forward. And also she's having difficulty in raising her feet. Okay, so she's unstable on her feet. She has, like I said, lack of appetite as well. She's not hungry. Tremor, like I said, in her right hand, and low blood pressure. Now, the thing here is very important. In acupuncture, low blood pressure. If a patient has low blood pressure, you have to kind of stable out his blood pressure, or even raise his blood pressure to get a better outcome in the treatment. Patients with low blood pressure do not respond well to acupuncture, what I found in my experience. All these patients that have low blood pressure, I try to stable or raise their blood pressure a bit. And the way I do it, I needle bilaterally with moxibustion on the needles, spleen 6 and 9 bilaterally. That is, and I leave the needles in for a couple of minutes. Okay. I leave the needles in sometimes with moxibustion on the needles. I leave them in for about 15 minutes till I can even feel that I can feel a pulse a lot more. That means the blood pressure is raised. Then after her treatment, I added gallbladder 34 with Si Sheng with the 4 points around Du 20, Si Sheng Chong Kong. Okay. Now, it is known that gallbladder 34 has an effect on the dopamine levels, has an effect on dopamine. So if Parkinson patients have lack of dopamine, it's going to affect the dopamine. It means they're going to have a better outcome. At the same time, I'm using Si Sheng Chong because I want to balance out in some way the yang going towards the head. So I like to use those points. It's also another way to connect to the area of the upper extremities through Si Sheng Chong. Okay, so that was the first time I learned for the patient. Every time the session mainly started like this, I left these needles in with every now and then I stimulated them for about 15 to 20 minutes. After about 15 to 20 minutes, I decided to apply Zhu's method. Remember, in her case, I actually found that her middle jiao was very, very weak. So the lack of appetite, the weakness, that means you're getting symptoms here of spleen tissue. And we know in Parkinson patients that a lot of time it is wood invading earth. So it means the wood is invading earth and actually weakening the earth. And then the earth is actually developing more and more dampness. And then it's not getting to function correctly. So I actually needled Zhu's middle jiao area and stimulate. Zhu's method of stimulating is in and out like pumping. Okay, so on both sides I actually done that method. I'll go to the location of the points. After I done that for about 5 minutes with stimulation of the area of stimulation of the points, I actually added YNSA points, ZS point on the left side. Because ZS point on the yin and yang aspect on the left side, because symptoms were appearing on the right side. Okay, so use ZS. ZS is a point that is used to lowers prolactin, and the way it lowers prolactin, it actually raises dopamine levels. And dopamine is the antagonist for prolactin, so ZS stimulates and raises dopamine. Okay, then I needle the basal ganglion. On the yang aspect because of the tremor. So a lot of times I found in tremor that the yang aspect is a lot more useful. And the basal ganglion point was needled because of the diagnosis in the area of the elbow. And we know that the basal ganglion also has an effect on Parkinson's, and dopamine is affecting the basal ganglion, and etc. Then I decided to use the eye somatotope of the lower extremities bilaterally. And then after all this was needled, we started doing a bit of do-in and moving and walking. And as the session went on, she went and improved. So now, coming to the area of the points, to locate the points. So like I said, I'm just going to use here quickly Ju's point. Ju's middle burner area, the middle jiao area, is around do 22 area. So do 22 area, all the area between do 22 to the lateral borders of the bladder channel is actually the middle jiao. So the threading was from, in her case, it was from anterior to posterior this way. 2 needles on the left side, 2 needles on the right side, which I didn't touch the center. At the same time, I stimulated these areas. That was that point of Ju's method. And I also started seeing that the pulse of the middle jaw was strengthening up. Okay, so here I'm just going to show you where the ZS point is. So the ZS point, if we have, okay, I'm hoping it will draw. Sorry. So the ZS point of YNSA, if we have, you have the anterior part of the temporalis muscle. Okay. So, okay. So I don't understand why it's not drawing for me. Okay. Okay, so I'm drawing the sideburn out here. Okay, and I have the mid-forehead line, right on the temporalis region. I go about 1 centimeter below the temporalis, the more anterior part of the hairline. Okay, centimeter below, and about 2 centimeters in. I just start moving with my finger inwards, till I feel the most deepest part in the temporal region. The most deepest part in the temporal region is where ZS point is located. And then to really know if you needle in it, at the same time, you palpate stomach 12. At the same time, you palpate in stomach 12, you locate that area, okay? And when the patient feels that, or you feel that the muscle in stomach 12, or where the scalenus muscles there connect, relaxed or less tender, then you know you're in the ZS point. Okay, so that's ZS point. The eye somatotope, area of the feet. If we have the ear, if we multiply the height of the ear, okay, we take the ear and we multiply it. Okay, we get up to the area here, from the apex, up to here. So it's actually 3 lines. One line is the thoracic spine that sits right on the apex line. Okay, so here it's going to be L1, T12. Here it's going to be the T1. Okay, then you have right here, we have the root of the ear. Here is where you have the shoulder. And then again, straight line, you multiply the height of the ear. Up here, you're going to have the palm of the hand. Okay, that's the area of the eye hand. Here is the shoulder. Okay, and then we have the lower extremities. If you go back to the ear, you feel your mastoid process, and you go up with the mastoid process. Over here, about here, behind the ear, you'll feel a divot. Even you can feel it on yourself now. That divot is the area of the hip. And if you go up, okay, again, multiplication of the ear, it's about 4 centimeters up. You have the area of the foot up here. Okay, and the hip is in that divot just above the mastoid process, above the mastoid bone. So what I'm doing, I'm going up with the mastoid process, going up, and then I fall into the divot. That divot there is the area of the hip. So that's the eye somatotope of the foot, thoracic spine, lumbar spine. Cervical spine sits right between the connecting between the ear and the face on the posterior borders of the mandibula, for example. Okay, this will be the cervical. This will be C7. This will be C1. Okay, and right on the mastoid bone, all of the mastoid bone is imitating the lower back, with that just about a centimeter above the mastoid process will be L1, and up here will be the sacrum area. And it's behind the ear, you can't see it, you can actually feel it. So that's ZS and I somatotop. Okay, basal ganglion on the yang aspect, okay, is located, if we would take right here, okay, if this is DU19, okay, that's DU19 location, you go about half a centimeter lateral to DU19, and that, you know, a 2 centimeter vertical line parallel to the sagittal suture, parallel to it, a bit about half a centimeter lateral. Right from DU19 sits the basal ganglion area on the left, and basal ganglion on the right. Okay, so was Sarah. Okay, another case is Aaron, 35-year-old man. He's a COO in a software company. He's been suffering from major headaches, migraines, severe, about three times a week. With Sahara, he has vomiting, sensitivity to light, sensitivity to smells. Now, all this occurred after he had a car accident. 10 years before that, he had a car accident, and after the car accident, he started getting these migraines. The migraines are also followed every now and then. He has a dizziness when turning his head to the right side. When he turns his head to the right side, he feels a bit unstable, a bit slightly dizzy. His blood pressure is 120 to 100, between 120 over 180, so it's very, very high. And he suffers from anxiety. Okay, and when he's sleeping, he wakes up from palpitations. So as we can see here in this case, we have been, if we diagnose in Chinese medicine, so we have in a lot of yang, you have a lot of yang hyperaction of flaring up of yang. You could say liver yang rising, okay, liver yang rising in this case. And you have in the gallbladders, you have in all that area around the ear, because he's having temporal headaches more. So the blood pressure, which is high, the anxiety, okay, it's all that heat going towards the heart, and he's having the anxiety. Or the palpitations in the night is when the yin is meant to take a balance, and it's the middle of the night. It's an hour of the clock time around the liver, the clock time around the gallbladder. That's when he starts feeling these palpitations. So it's again the overaction of the liver yang rising. So in his case, I palpated the area of the ascis, and I done gallbladder 41 on the side. The ascis is sensitive. That's from Japanese acupuncture to know that you have hyperaction of the daimai channel. Okay, so I needle or the yang qiao, yang wei. So I done a gallbladder 41 right side according to the sensitivity of the ascis, then contralateral sanjiao 5, and I left him for about 5-10 minutes. Afterwards, I added Yu Yao and Tai Yang also to clear up the area of the dampness or the heat around this area of the wind in the upper area of the face. DU20, I needled to actually balance out the yang, to balance out the yang to only axis or deficient. And then in YNSA, I needled the cerebellum on the right side. First of all, the cerebellum stimulates the same side. So that means if he's turning his head to the right and starting to feel unbalanced, that means he's got a problem with his cerebellum in the right side. But also, I use that because according to the palpation in the area of the elbow, the right side cerebellum was sensitive. And then I needled in the area of the epsilon points, which are located in the temporal region, PC, liver, and lung. Now, another thing, PC, liver, and lung are areas of the fascia that if you release them, you can actually release temporal headaches and migraines. So a lot of times when I see a patient, I palpate these areas and just massage them, and then it reduces pain and headaches from the reduces the headaches and the migraines. So that was her and of the fascia manipulation. So going to where the lung, pericard, what was that? Lung, pericard, liver, and lung. So pericard, lung is the meeting point of the anterior hairline. Okay, as you can see here in the mid-forehead line. That's the lung epsilon point. The heart epsilon point is the connection between, if you have the root of the ear here, you go about 2 centimeters above the root of the ear, and you have the connection of the mid-forehead line. Okay, that will be heart. And then in between the heart and the lung, you have the pericardium. Okay, so what I try again, draw it. If you have hairline, the mid-forehead line is a connection towards Do17. Okay, and then you have the apex line. Okay, so here would be lung. Here's the root of the ear. So I go the root of the ear direct up. This will be heart. So you have lung, heart. Okay, and then in between the two, you would have a pericard. Now, even by massaging these points, and I forgot liver, okay, and liver is about here, just below the heart, okay? But even by massaging these points, you relax the temporal muscle. By relaxing the temporal muscle, you're gonna have a large effect on releasing temporal migraines. So this is also recommended if you're not an acupuncturist, just massage these areas. Another combination that was used was tinnitus combination. The tinnitus combination is gallbladder 19 is the ear yang point. The ear yin point is on the corner of the face. So you would see it here. If you take the upper third of the face and you go in the height of the lateral border of the outer canthus and the mid-forehead line, you'll come to a point here. That'll be the ear yin point. And then 2 points that are located in between the two. One is in a straight line. If you would take the triangular notch and you would go direct straight up, okay, to the superior borders of the temporalis muscle, you have tinnitus 1, tinnitus 2, okay? And if you take here a 45-degree angle up and back, you'll fall on the superior borders of the temporalis, you'll fall into tinnitus 1. So that's the areas of the tinnitus points. Okay, cerebellum. The cerebellum point is if you have, I'm using this image and not the drawing, if you have 1 centimeter above the hair, okay, A point is located around the line of bladder 2. So you go to with bladder 2, you go straight up to the hairline, and then you go 3 centimeters into the hairline, and that's the area of the cerebellum. Okay, and that's the same line of bladder 2. So that's the cerebellum. Okay, so that's it. That's our presentation on how we used cases. You can go over these videos again and again and go slowly on the sections of the location of the points. I hope you enjoyed it. Thank you very much for attending. It's not, I don't take it for granted. So let me stop sharing my screen quickly. So thank you very much, all of you. Hope you enjoyed it.
Ευχαριστούμε πάρα πολύ, vi ringrazio molto anche voi partecipanti dall'Italia. Vi ricordo και σας επιθυμίσω ότι οι ημερομηνίες για τα μαθήματα του David στην Ελλάδα είναι το 12, 13, 14 Νοεμβρίου στην Αθήνα και 29, 30, 31 Οκτωβρίου στη Ρώμη. Vi ricordo che le lezioni in Italia saranno il 29, 30, 31 di ottobre. Questo è il nuovo libro di David, è disponibile diafesimo στην εταιρεία ITME στην Αθήνα Είναι το καινούριο livro, είναι και το καινούριο βιβλίο με πάρα πολλές καινούριες έρευνες του David και του Evi Avier. Λοιπόν, ευχαριστούμε πάρα πολύ και ελπίζω να πούμε και από κοντά. David,
Bye, Gracia. Good night. Keep safe.
I will see you soon in Athens.
Okay.
And Europe.
Good night.
Bye.
Hope you will keep safe. Bye.
Bye, bye, bye.
Bye-bye.